Welcome to our exploration of psychological disorders. In this video, we'll delve into various categories, including trauma and stressor-related disorders, feeding and eating disorders, and personality disorders. Understanding these disorders is crucial for promoting mental and physical health. We'll explore their symptoms, causes, and treatments using dynamic graphics and real-life examples. By the end of this journey, you'll gain deeper insight into how psychological theories and integrated approaches play a role in identifying and treating these conditions. Let's start with trauma and stressor-related disorders, focusing on post-traumatic stress disorder, PTSD. These can develop after traumatic events like serious accidents, natural disasters, or personal assaults. PTSD is characterized by symptoms such as hypervigilance, flashbacks, insomnia, and emotional detachment. Hostility and anger can also manifest, making relationships challenging. The causes of these disorders are typically linked to the traumatic event, but factors like genetics, personality, and prior experiences also play significant roles. Next, we explore feeding and eating disorders. Anorexia nervosa and bulimia nervosa are notable examples. Anorexia involves intense fear of weight gain and distorted body image. Bulimia involves cycles of binge eating followed by purging behaviors. Both disorders have severe health consequences, including malnutrition, electrolyte imbalances, and dental erosion. The causes are multifaceted, including societal pressures, psychological factors, stressful life events, and family history. Understanding their complexity is crucial for effective empathy and support. Now, let's delve into personality disorders, divided into three clusters: A, B, and C. Cluster A involves odd or eccentric behavior, like paranoid personality disorder with its strong distrust of others. Cluster B features dramatic and erratic behaviors, exemplified by antisocial personality disorder, where there's a disregard for others' rights. Cluster C includes anxiety-related disorders, such as avoidant personality disorder. The causes blend genetic predispositions and environmental influences like childhood trauma. Understanding these disorders requires a multifaceted approach, acknowledging both nature and nurture. To understand psychological disorders, it's crucial to consider various theoretical perspectives. The biological perspective focuses on genetics, brain structure, and biochemistry. The psychological perspective examines experiences, emotions, and cognitions, including the impact of childhood experiences and internal thought patterns. Psychological theories, like Freud's psychoanalytic theory and cognitive behavioral approaches, are key here. The social perspective looks at how family dynamics, cultural norms, and socioeconomic status impact mental health. Integrating these perspectives provides a comprehensive understanding for effective diagnosis and treatment. Effective treatment often requires integrated approaches and evidence-based practices. Cognitive behavioral therapy and medications can balance brain chemistry and alleviate symptoms. Mindfulness-based therapies use techniques like meditation for stress reduction. Coordinated teamwork among professionals ensures all facets of a person's condition are addressed, from physical to social well-being. The personalized approach treats the disorder and empowers individuals with skills for long-term recovery. Understanding these methods is crucial for managing and overcoming psychological disorders. Let's look at some real-life examples. Sarah has PTSD and finds comfort in cognitive behavioral therapy. Jason, with anorexia nervosa, learns healthier ways with the help of a medical team. Michelle, living with borderline personality disorder, manages her symptoms through dialectical behavior therapy. These stories highlight resilience and strength in managing psychological disorders. It's important to connect what we've learned about psychological disorders with previous topics like developmental psychology and learning theories. These foundational ideas shape our understanding of mental health. For example, growth mindset principles can influence therapeutic approaches for PTSD or eating disorders. This holistic grasp emphasizes the value of integrated treatments for mental health care. Take a moment to reflect. From trauma and stressor-related disorders to feeding and eating disorders and personality disorders, apply these theories and approaches to real-world mental health issues. Consider how the knowledge of these disorders helps you understand the behaviors and challenges around you. Integrated approaches and evidence-based practices are key for comprehensive treatment. As we wrap up, let's review. We started with trauma and stressor-related disorders like PTSD, then covered feeding and eating disorders like anorexia nervosa, and personality disorders like antisocial personality disorder. Remember, this is just the beginning. Continue exploring and learning about these topics. Understanding psychology helps foster empathy and contributes to a more understanding world.